Well, I think all the things we've talked about here are the things that we can assess. And so I'll turn to you to close out this section, Amy, and say, how about the patient's perspective? How about the effect on quality of life? What do you look for to gauge whether the treatment strategy for a relapse or the treatment strategy in general is actually optimizing that patient's existence in this world outside of the minutes that they spend with us being poked and prodded and otherwise assessed in the office?
You know, I do a lot of phone management, and sometimes it feels like phone chit-chat or socialization. So when I go home, I don't ever answer the phone. But, you know, one of the things that we do at about a month is the follow-up for the ARMS questionnaire. But if I know these patients, I've gotten to know them, I talk to them about themselves and what they are. How are you doing with the kids? How are you doing with that new computer system at work? How, you know, yeah, they can say their walking has improved, but if their walking has improved, but they're so fatigued by the time they get to the office from the train, maybe this hasn't been the success that I had wanted it to be. So I try to get to know them. I try to individualize it. As you say, look at what the impact has been on their quality of life. I mean, having a relapse is a blow to your quality of life, no matter what kind of relapse it is. And so sometimes we want to get them back to the baseline. Sometimes with steroids, they go well above the baseline, and we have to establish where that is too. I mean, are they just still coming down from steroids, or aren't they? And then one of the even tougher questions that we face is, all right, we've had a relapse, we've treated the relapse, now what? Do we look at a new disease-modifying therapy with the whole issue of NIDA? How tolerant are we of a relapse? How bad was this relapse? What precipitated it? Might there have been things that we could do? Is it time to make a change? Is it not? How do we assess adherence? So this opens up a whole another bag of issues for us to address. But really, look at the impact that this relapse has had on their quality of life.
It can also impact them emotionally too. If somebody thinks that they're doing well on the treatment that they're on and then this occurs, oftentimes it can feel like an even bigger setback for somebody than it might have been physically. I think it's an excellent point. I had a patient quite a number of years ago who said that every time something happens to her from her MS, she felt that she needed to construct a whole new idea of what the new normal is, kind of rebuild her whole sense of how she navigates the world. And that's emotionally exhausting, as well as sort of unsettling for people. So I think addressing that unpredictability, helping them navigate after an event, even if it seems minor from the way we look at it, is an important part.
You know, sorry, Rob, a term that we often throw around as clinicians is treatment failure. I try to wipe that out of my vocabulary, and I talk to the patients about how you're not a treatment failure, you're not a failure. You may not have responded as optimally as we would have liked to treatment X, Y, or Z, but let's think about not, you know, driving off the cliff, but modifying the route a little bit.
Yeah, and you know, Stephen, I love the sentiment that you expressed about you know, how to address the implications of a relapse, really with the whole patient in mind, the whole person. And that brings to mind the team concept of MS care. It's something we see here manifest at the CMSC in a very real way with multidisciplinary attendees attending this meeting. And we can't forget the importance of leveraging the rest of the team, physical therapists, in our practice, health psychologists, to deal with the stress and the uncertainty of what's happening and help people frame that and get it under control. Occupational therapy, social work, all the implications of this really require a team in the best case scenario. We've talked a lot about medications and how we do the neurology decision making, but from the patient's perspective, that's really only a small sliver of things.